Ohida Binte Amin, a second-year PhD student in Personal Health Informatics program, a joint program between Khoury College of Computer Science and Buffet College of Health Science. Currently, I am involved in SATH Lab, which is for signal processing and artificial intelligence for time-variant health data under supervision of Dr. Aarti Sathyanarayana. In our lab, we try to develop cutting-edge signal processing and machine learning methods to improve human health and performance through digital devices like wearables, smartphones, or any other medical devices. For instance, we are interested in leveraging smartphones and wearables that we have today to help empower students to improve and better understand their mental well-being through digital phenotyping and machine learning. We are also interested in EEG signals to identify biomarkers for oxygen desaturation levels during sleep and also to find out patterns for sleep apnea. We are also interested in identifying or predicting disagreements in romantic relationships within juvenile adolescents with their romantic partner on a particular day from their text messaging data by analyzing the message length, the response time, and also the negative or positive sentiments in those messages using natural language processing and machine learning. As a part of the lab, my current PhD research focuses on machine learning, artificial intelligence, and human-computer interaction for digital health, specifically stress, depression, and sleep using data analysis, trajectory modeling, and digital phenotyping. I am particularly interested in college students because they often experience stress, depression, or any other mental health issues because of constant academic demands and other social pressures. I am interested in improving digital phenotyping mental health assessment by integrating wearables and smartphones that we have today and by collecting context-based physiological and behavioral data. Actually, smartphones and wearables already collect a vast amounts of data, so why not use those data to understand our own behavioral patterns and to improve our own mental health. By using these digital tools, we can quantify our mental health, we can see any improvements or declines over time. Let's think about a student who feels very uncomfortable about one of his classes that happens every Wednesday, and that leads unknowingly to experience a high spike in their weekly stress levels. If we look into the behavioral patterns for that student for one long semester, including their all class times, class locations, we can identify the root of that Wednesday high stress, and that can offer some clarity and opportunities for them to improve the situation. And also, stress is very subjective. If I rate my stress right now like 3 in a scale of 1 to 5, 1 being the lowest and 5 being the highest, any other person can perceive that stress like 4. So it varies person to person, and also mental health issues are influenced by personality characteristics. Like in our prior work, we investigated the social interaction patterns which was linked to depression within different personalities using digital phenotyping. And we found that highly neurotic students who had higher depression had more variation in their number of social contacts throughout their one academic semester. So the interpersonal intervention for that group to improve their mental health was like to encourage them in maintaining a consistent social interaction patterns both online and offline throughout their academic year or semester. And as I said earlier, data which we can collect passively like GPS location, our physical activity, our social interaction, or our phone or SMS logs, or any other physiological data like our heart rate, our skin conductance, or respiration can identify anomalies in our normal behaviors. And we can understand which behaviors impact our own mental well-being. So currently I am focusing on extracting features from both smartphones and wearables to predict daily stress in students, and our long-term goal is to provide just-in-time interventions to the highly stressed individuals. And also, as stress and sleep are related to each other, we are also interested if we can see the impact of stress on sleep within individuals having high, low or medium levels of stress. I am also planning to build machine learning and deep learning models to identify sleep from the physical activity data when we are awake. And also, if we can predict stress after analyzing last 7 days sleep patterns. So I believe my research on digital health will enhance our knowledge about the dynamics of mental health and also opens the doors for more proactive and personalized interventions. Being involved in our lab has so many benefits, both professionally and educationally. Professionally, the guidance I receive from my PhD advisor for brainstorming research questions or writing research paper or presenting our insights to the audience, and the consistent encouragement for my self-development are invaluable. These helps have enhanced my ability to convey the complex ideas more clearly and also encourage me to pursue knowledge and work for self-development. And for educationally, we always have our weekly lab meetings where we share our research updates to everyone, we learn from each other's work, and we receive and give constructive feedback. And this collaborative environment not only enhances our knowledge base but also helps us improve the problem solving and analytical abilities through diverse perspectives and challenges. I always aim to improve human health and performance through innovative signal processing and machine learning methods using data from smartphones, wearables and medical devices. And I believe that advanced machine learning methods have the potential to impact healthcare systems all over the world. But originally I was from a computer science background, and before joining Northeastern I was a software engineer in a telecommunication company, and I always cherished a dream to contribute my technological knowledge into healthcare, and being involved in our lab into this PhD program at Northeastern, it helps me to put one step forward towards my dream. And I also have gathered hands-on experience working with physiological data like heart rate, interbeat intervals, respiration, skin conductance, and also I know now the potential of these fields to improve our lives.